The real impact happens when we stay focused on what matters most, creating solutions that meet communities where they are and make public health work better for everyone. When we get this right, we're not just solving today's health challenges, we're building a stronger, more responsive public health system for generations to come. Greetings, everyone, and thank you for joining me on this episode. Welcome to Public Health Entrepreneurs, the podcast for visionary leaders who are ready to transform public health and healthcare through innovation. I'm your host, Dr. Charlotte Huntley, and as a public health entrepreneur with over 25 years of experience in healthcare and public health, I understand the unique challenges and opportunities that come with bridging multiple disciplines. If you are a high functioning leader with expertise across different fields, whether you are a medical doctor, a dentist, pharmacist, who also has a public health degree, or a public health doctor who also has expertise in another field, or any other interdisciplinary professional, you know what it's like to see opportunities that others miss. You understand the gaps in our current systems and you have ideas about how to make things better. But sometimes having a unique perspective can feel isolating. I definitely understand, and it is why we focus this podcast, especially this current series of episodes, to provide you with the type of support that you need. Now, in today's episode, we are going to take the discussion from our previous episode about breaking free from traditional systems a little further to discuss creating impact through public health innovation. There are three things that I would like for you to consider. This is a great episode to take notes if you're a note taker. The first point is the importance of understanding system limitations, common barriers in traditional public health systems, why conventional approaches may fall short, the cost of maintaining status quo, and signs of innovation or signs that innovation is needed. Let's talk about why our public health systems need a serious update. Picture a city's public health department trying to track disease outbreaks or coordinate vaccination campaigns with tools from a different era. You might say, that's my department. Our current systems often get tangled up in bureaucratic red tape and struggle to share vital health data across different agencies and communities. Instead of getting ahead of public health threats through prevention and community-based programs, we're constantly playing catch up, whether it's emerging infectious diseases or environmental health risks or chronic disease prevention. The real cost isn't just dollars, it's in missed opportunities to protect entire communities and prevent health problems before they start. When we see growing gaps in health outcomes between neighborhoods, delayed responses to disease outbreaks, and public health departments struggling to engage with communities effectively, it's a clear signal that we need fresh approaches. The future of public health needs to be more nimble, data-driven, and deeply connected to communities it serves. The next thing that I want to point out is the importance of identifying opportunities. So that includes framework for gap analysis, methods for opportunity identification, and understanding user needs and pain points, as well as evaluating market potential. Now, when it comes to making real change in public health, it all starts with figuring out where we can make the biggest splash. Think of it like being a detective. We need to look very carefully at our current systems and identify where things aren't working as well as they could. But here's the exciting part. Once we find these gaps, they're actually doorways to opportunity. The real magic happens when we get out there and talk to people, like the school nurse who's struggling with outdated health records, or the community health worker trying to reach families in a remote area. These conversations reveal incredible insights that Well, it's about what's really needed on the ground. Mix these real world insights with solid data analysis, and suddenly we can see exactly where innovation solutions can make the biggest difference. Now, of course, we have to be practical too. So, great ideas need resources to work, and they need to be something people will actually use. When we get all the pieces right, that's when we create solutions that don't just sound good on paper, but actually make life better for entire communities. Now, finally, I want to note the importance of an innovation strategy. Types of innovation in public health, risk assessment and mitigation, building support for new ideas, and resource allocation and management. So let's explore how we can turn public health ideas into real world change. Think about innovation in public health as a spectrum. Sometimes it's about creating brand new solutions, but often it's about finding smarter ways to use what we already have, like turning a basic contact tracing system into a dynamic community health network. Of course, trying new things in public health means we have to be thoughtful about risk. I mean, of course, we're dealing with people's well being here. This is where having a solid game plan comes in. It starts with getting key people on board, from community leaders to health workers to local officials, because good ideas need champions to thrive. But here's the real challenge: making smart choices about where to put our often limited resources. It's like being a chef with just enough ingredients to make dinner. You need to know exactly where each component will make the biggest impact. Success often comes down to finding that sweet spot between bold innovation and practical reality while keeping community needs at heart of every decision. It's not easy. So, as we sort of wrap all these together, when we think about creating real impact through public health innovation, it all comes down to taking smart risks, and these smart risks genuinely improve people's lives. We've talked about the challenges in our current system and exciting opportunities ahead, but what really matters is how we turn these insights into meaningful change that communities can feel. The beauty of innovation in public health is that it comes in all sizes. Sometimes it's a game changing new technology, but often it's a clever tweak to an existing program that suddenly makes it work better for everyone. What makes me optimistic is seeing how public health innovators are already making waves, from designing new inclusive health education programs to building community led health initiatives that really stick. Sure, we're facing obstacles, but not every idea will be a home run, but that's part of the innovation journey. The real impact happens when we stay focused on what matters most, creating solutions that meet communities where they are and make public health work better for everyone. When we get this right, we're not just solving today's health challenges, we're building a stronger, more responsive public health system for generations to come. Now it's your turn. What can you create? Or how can you level up what you've already created? Remember that as a leader with expertise across different fields, you have an interdisciplinary advantage. As we wrap up this episode, I'd like to remind you that I have support for you in two different ways for your public health entrepreneurial journey. If you're looking for personalized guidance, let's work together one-on-one. This is not something that I'm always able to offer, but it is something that I'm able to offer in this season as you're listening to this episode. So as someone who understands the challenges, the unique challenges of being an interdisciplinary leader, I can help you turn your innovative ideas into reality. Or if you are ready to join a community of high functioning leaders like yourself, consider applying for our premium mastermind group program. You'll connect with other professionals who, like you, are bringing multiple disciplines together, creating meaningful change for public health. Visit Public Health Entrepreneurs to learn more. You'll need to directly message us through the contact page if you're looking for one-on-one support, but you'll find a lot of information on our mastermind group program right from our website. Links will also be provided in the show notes. All right, everyone. Until next time, have a fantastic rest of your day.